Hello, my name is Scott Hamilton, and I am the Director of Pediatric Dentistry for the University of Nebraska Medical Center, College of Dentistry. I am here to answer some questions about oral health for children, especially young children today. The ADA, American Dental Association, recommends that a first dental visit be completed by age 1. And about age 1, most parents will say, well, my child's really not ready to go to the dentist yet. They're going to just make noise and be uncooperative, and they're not ready yet. And we say, well, we know they're not ready yet. They will be noisy, and that's okay. But the old mindset was we just have to have a healthy adult dentition. And however we get there, that's okay. That may mean cavities and broken teeth and sore teeth and pain and even infections in the primary dentition. And as long as the permanent teeth are healthy, that's the goal. But we've changed that now to thinking, well, why should a child have to go through all that? Let's try to prevent the cavities in the primary dentition as well. So starting as early as age 1, that first visit, the idea is just to teach you how to prevent cavities. How we do that, at an age 1 visit, we will demonstrate how to brush your child's teeth. We will do a fluoride treatment, we'll do an exam, look for any cavities, and then we just spend quite a bit of time talking with you about some prevention things you can do. Some parents don't know that you're not supposed to put your kid to bed with a bottle or a sippy cup. And you'd be amazed how many children, even by their 2nd birthday, can already have cavities if they've been drinking a lot of juice or Kool-Aid, or maybe even the things you haven't thought of that can cause cavities. So that first dental visit, we really don't expect to find cavities at age 1. We just want to teach you, give you some tools to prevent those cavities from ever forming. We just want to make sure you choose a toothbrush that's age appropriate, and that basically means it'll be the right size. We don't need to use a really large toothbrush on a young child, or vice versa, too small of a toothbrush for a little older child. But the main thing to look for is just that it has soft bristles. As far as toothpaste is concerned, anything with fluoride is preferred to anything without fluoride. This is a sample of a Kid's Crest. It's bubblegum flavored. They make like a Sparkle Fun is the name of the flavor. There's Kids Colgate, and you can go to a grocery store and you can find 100 different flavors practically. The Shrek and Dora, etc. Just out of all those flavors, just make sure you choose one that is something that does contain fluoride. Now, as far as when to start using a fluoride toothpaste, basically children are going to swallow toothpaste all the way until they're 3 or 4 or 5. Teaching them to spit out the toothpaste is not easy on especially young children. So we do plan on them actually swallowing the toothpaste when they're done. To prevent any fluorosis, which is what happens when you get too much fluoride, we want to just make sure you're using a small amount of toothpaste. Now what you can do is take a small dab of toothpaste, just a little smear that goes across the bristles, about like this. You'll hear that called a pea-sized amount, no larger than a garden pea. And if this amount of toothpaste is swallowed every day, even twice a day, that should be safe for kids. Something else you can actually do is just hold the tube up and just kind of dip the bristles down in a little bit, just so you've got just a little bit on there, just enough where it foams up when they brush, where they can get the flavor, foams up a little bit, but where they're not swallowing large amounts of toothpaste. Now when it comes time to actually brush your child's teeth, what we usually recommend is that you have your child lay their head back into your lap, and you can be sitting on a couch or a comfortable chair, a beanbag chair, the floor, the bed, whatever, wherever your child would be most comfortable. Now they may resist, and it's very normal for kids to go back and forth between very cooperative with brushing and very uncooperative. But especially when they're uncooperative, if you imagine trying to brush while they're standing up, you may get 2 or 3 brushes in and they take off running the other direction and you're done. Well, you haven't actually finished the job yet. So if you can have the child lay their head back into your lap, then we want you to actually hold the lower lip out of the way with your left hand and brush with your right hand. If you're right-handed, of course it's the other way if you're left-handed. And then when it comes time to do the top teeth, same thing, you actually hold the lip out of the way with your left hand and you brush with your right hand. We do also want to have them open their teeth, open their mouth, and brush on the inside surfaces as well. And it should take you a good 45 or 60 seconds if they have some of their teeth in. It may take closer to 2 minutes if they have the full set of 20 teeth in. We usually let kids start brushing their own teeth about the time they can tie their own shoes, which is generally roughly age 6 or so. Up until then, they just don't quite have the coordination to do it themselves. So when you have a child that throws their hands down and says, "I can do it myself," let them go second. Go ahead and you do the brushing, but then you can hand them the toothbrush and they can try as well. We like that they're interested, but just keep in mind, if you hand a 2-year-old a toothbrush and you don't do it, then they're getting their teeth brushed by a 2-year-old. So make sure you're still the one doing the brushing. Well, to cause a cavity, you really need 4 things. One of those is genetics, and that's out of your control. Some kids truly are more susceptible to getting cavities than others. And unfortunately, we've seen some kids that do everything right and still get cavities. We've also seen some kids that practically do everything wrong and they don't seem to get cavities. Well, that part's out of your control, but the 3 things you can control. The first one is fluoride, and it is up to you to make sure they're getting the right amount of fluoride. You should discuss that with your dentist at that first visit and at follow-up visits if the water you're drinking changes, for example. Keeping the teeth clean. You mentioned brushing, but there's also flossing, and you'd be surprised how many cavities kids get that we consider the flossing cavities. A toothbrush can reach, these areas on the tops of teeth and out here on the sides, but in between, right where a toothbrush bristle can't go, kids are likely to get cavities in there as well. I call those flossing cavities, and they're very common. So we do start flossing at an early age. And then the third thing that you should think about is limiting sweets. And it's amazing how many ways kids get sugar. I mean, you think of a lollipop, and for kids, or for grown-ups, it's pop and candy. But for children, it's anything that's sticky. Fruit snacks have a lot of sugar. Fruit juice is a main culprit. You know that you're not supposed to let your kids drink much pop, but then when they drink juice, they're getting almost as much sugar, actually. And they may be carrying around a sippy cup, taking little sips or little drinks of juice all day. That just means basically they have sugar in their mouth all day, and it's no wonder they get cavities. So we have to watch all the different ways that they may be getting sugar and limit their exposures each day. Well, baby teeth act a lot like permanent teeth in that they can get cavities, they can be painful, they can have infection. It's an uncomfortable thing for a child to have a toothache, whether that be in a permanent tooth or in a baby tooth, including many, many missed days of school, expense, even hospitalizations due to infections from primary teeth. So we believe, while they may not have their primary teeth when they're in their 20s, 30s, all the way up to 100, we do expect that we do everything we can to prevent cavities and to take care of the baby teeth as well. Dental home is a place where you have a dentist that knows your child and can take care of them, whether that be for every 6-month checkup or for the more emergent things that may happen. And a good example of this is maybe there's 2 children that are 2 or 3 years old that each have a similar dental injury on a playground. The child that's been to a dentist before, the family can hear about the dental injury, immediately contact the dentist, possibly even have that child in the dental office within 20 or 30 minutes. If a child has never been to a dentist before, then it's a little more of a, well, first of all, how do we find a dentist? And you dig out the yellow pages or you go to the internet. And then you start calling dental offices and you ask if they're available to see your child, and you ask if they take your insurance and so on. It may be several hours or maybe even the next day before you can even have your child seen. So in situations like that, it's easy to see why it'd be nice to have a home for your child. The other part of it is, from the child's perspective, it really is nice for them to become familiar with a dentist. The first trip to a dentist your child might be a little fearful, and that's pretty normal. But by the time they've seen a dentist a few times, they become really comfortable in that office. Thank you for listening, and I hope this has been helpful. If you do have any other questions, if you need more information, please contact your dentist. Please go ahead and get your child into the dentist if they're age 1 or older and have not been seen yet. And any other questions, please take a look at the websites that we're including here for you.